Good morning and welcome to the live stream from Deuk Spine Institute. It's November 14, 2023. Today we have 3 surgeries for you. We originally had 4, but our last patient apparently was admitted to the hospital with kidney stones and possible bladder infection. So we won't be doing our last surgery today, but we'll be doing 3 surgeries. Our first surgery is a patient who suffers with neck pain and it radiates into the shoulders. There's some headache, and now she's been following us for a while, and I'm not going to say her name, of course, but she has 3 discs that are damaged in her neck, and our goal today is to fix those 3 discs. She has a beautiful neck, and I'm going to try to do everything with 1 incision. I don't know if I'll be able to. So we're going to be fixing C4-5, 5-6, 6-7. C4-5, C5-6, C6-7. All 3 discs are herniated, and all 3 discs have annular tears. We believe they're symptomatic. Our herniations are small. They're not big, but they are painful. She's been suffering with pain for how long? 18 months, so about a year and a half. Now she's from Minnesota, so she traveled to Florida to have this treatment done. All right, we're going to start by displacing trachea and esophagus. Can you see all this, Sanjay?
Yes, I do.
And then I'm going to use a spinal needle shot. 2, 3, 4, 5, 6, 7. Everybody agree that we're almost at 5, 6. That's the middle, correct? 5, 6 is the middle. So once again, I'll try to get everything done with 1 incision shot. 2, 3, 4, 5, 6. All right, so we're ready here to go in. Shot. It's amazing. Her skin is literally right up against the spine. See, my needle is not inside right now. It's outside. Shot. Let's get a quick AP and see where we are. We want to make sure that we are in the midline. Shot, quick. Perfect. Lateral. So we're just in the midline with the tip of the needle. 2, 3, 4, 5, 6. Everyone agree? 5, 6. Shot. All right. I'm quite literally right on the disc already. Shot. Let's get a quick AP once again, just verify. Maybe a little bit to the right. Quick shot. Nope, it's perfect, centered. Very good. And shot. All right, so I'm a little bit at the bottom of the annulus. I'm going to slide up just a little bit. Shot. And we're entering the annulus. And shot. Okay, let's get an AP view. Oh, everyone agree we're at 2, 3, 4, 5, 6. Hold on. And shot. Perfect. Look at that, dead center. Hold on, stay there. I'm going to do a little discogram. Shot. Could feel the dye leaking out. Shot. Lateral. Yeah. Look at that. Beautiful. Show us their anatomy there. Let's count from the top. 2, 3, 4, 5, 6, 7. All right, so we're at the 5, 6 disc. You see the tip of the needle where the arrow is, and look at the tear. It's a very kind of irregular tear through the annulus, up and down, feathered. And then you see the dye leaking out there, folks. That's in the epidural space. And you can see the herniation. It's kind of a negative image right there. Yeah, that little mountain sticking off to the side at the back of the disc. So that's the herniation at C5-6. All right, stay there, and we're going to place our guide wire through the needle So far, everything's going well for this young patient. Shot. I'm going to next do some num-num medicine. So there's our 1 drop of blood probably for the whole surgery right there. You guys see that, Sanjay?
Yes, we do.
One, not even a full drop, a half a drop to be honest. We're going to put some numbing medicine to numb the skin. At the beginning, we don't know where our entry point will be. We have to use the X-ray to find the entry point. So far, everything's going well. Let's run our video, Sanjay, explaining how these annular tears in the back of the disc, they're called a posterior annular tear, why are they so painful? All right, welcome back. We are proceeding. Can you see this, Sanjay?
Yes, I do.
Now let's show the lateral X-ray view. Sanjay, go to the X-ray view.
Yes.
Do you see it?
Yes, I do.
You see the white arrow moving?
Yes, I can see that.
All right, you can see the tip of the guide wire at the back of the disc, right where the herniation is, right where the tear is. We're inside the tear. And you can see the endotracheal tube in the front. It's a single line. You could see the esophageal temperature probe, which is abraded. And then you see, we're going to bring this, come back to the operating table. Can you guys see this ruler? Sanjay, do you see the incision?
Yes, I can see the incision.
All right. So Sanjay,
Yep.
we have a talk to give to the Moroccan Neurosurgical Society. They want me to talk about the surgery.
Okay.
I think it would be good to show them this surgery
Yes.
and have Henry kind of do a abbreviated version, sort of the highlights. Okay?
Yeah.
So here's the dilator going down through the 4mm incision. Okay. You guys see that shot?
Yes, I can see that.
All right. So go to the X-ray.
Switching to X-ray.
Anytime I say shot, switch to X-ray.
Copy that.
You don't need any traction now. Shot. We're at the front of the disc now. Give me an AP view, please. Stay with the X-ray. Shot. You can see the tip of the dilator is in the midline. Show us that. Yeah.
Such clear anatomy, that's nice.
Yeah, it's nice when there's not a lot of soft tissue. All right, let's go back to a lateral view. I'm going to advance my guide wire, dilator over the guide wire. Shot. I'm going through the anterior fibers of the annulus. Guide wire is removed. I'm just going to tap this dilator in, and I'm going towards the herniation in the back. Shot. So, Sanjay, will you let Henry know I want to use this particular surgery video? Zoom, yeah. Shot. When I say shot, remember to go to the X-ray view.
Copy
and then
that.
come back after 3 seconds to 5 seconds.
Copy that.
Shot. You could stay, actually you could come back to the operating view now.
Okay.
I'm right on top of the spine. I have to advance my tube. We're doing the entire surgery through a 4mm tube. Shot? Is that my shot, Jordan?
Yes, sir.
Uh-huh. All right, so I'm going to pull back my dilator. Shot. Shot. Uh-huh, let's try that. Shot. You have to feel for the movement of your tube. That's it. Done. Okay, go ahead and get a shot. Now show that picture there, Sanjay, the X-ray. And then come on back.
Copy that.
Can you see this here?
Yes, we can see that.
Excellent. And once again, keep your camera here. Make sure you show the small incision, okay?
Yes, Dr. Deuk.
Can you see that?
Yes, we do.
All right, next we're going to bring the endoscope. You can see the endoscope, Sanjay?
Yes, I do.
Go ahead and capture this image right here so we can show the neurosurgeons.
Yes, Dr. Deuk.
Good? Take a picture of it, Sanjay. I want to use this surgery for the website
Just a
because
minute.
it shows everything, the scope, the camera, light source, irrigation, laser fiber, and our tube and the incision.
Yes, Dr. Deuk.
Actually, let me see the ruler. So save this for the website. Make a note. It's very important. I want to use this one to show pictures from. Okay?
Yes, Dr. Deuk.
Get a good zoomed in one as well.
Sure.
All right? You ready?
Just a minute, doctor. Copy that. Just done.
Good?
Yes.
All right, we're going to get started. Remember, we've started with C5-6. We're going to have to then go down and up one disc after we're done with this one. Let's go ahead and show the video on how this Deuk laser disc repair surgery works. Okay?
CyberConnect.com.
No questions.
This is all herniation right here, you can see. Oh, there's a piece of herniation, just popped out. We're going to get rid of it. Remember, for those of you who don't watch these surgery, there's another herniation. The herniated disc is really not one herniation, it's many pieces. And that's something a lot of people, there's a third piece. A lot of people don't understand that. They think a herniated disc is one herniation, but it's actually a collection of herniations. In her case, she has 3 discs, and each disc will have between 20 to 30 pieces of herniation on average. That's what we typically will see. Any questions, Sanjay?
We have a question from Bali Ahmed on Facebook.
Sure. Hi there, welcome.
Hi doc, if
Hi.
there is a neck instability, does it get fixed once the surgery is successful, or is the instability a different issue?
Yes, so great question. Somebody is asking about instability. What is instability? Does anybody know? Of course I know the answer, but most people don't. They think they know what instability is. Instability is when patients experience severe pain in the neck or back with or without a neurological deficit, with normal physiological activities. So just doing normal things that you normally do every day. If you're experiencing pain or weakness, numbness, tingling in your arms or legs, that is instability. The Deuk laser disc repair cures pain, and it cures the neurological symptoms of weakness, numbness, and tingling. So yes, the Deuk laser disc repair cures instability. As a matter of fact, it does it better than any other surgery out there. Other types of surgery, for example, fusion. How many people have fusion and they still have pain? Lots. How many people have artificial disc and they still have pain? Lots. So those surgeries, those fusion surgeries, artificial disc surgeries, none of them fix the instability. They may improve a little bit, but they don't actually cure it. The Deuk laser disc repair is actually the best surgery in the world for curing instability. There's another herniation. So the instability, it turns out, comes from the annular tear that we're fixing right now. And the best treatment in the world for an annular tear is what you're watching today, the Deuk laser disc repair. There is no better treatment. Therefore, since the annular tear is the cause of instability, then this procedure is the best procedure in the world for treating instability, because it's the only one that just targets the annular tear. Now, of course, other doctors will tell you fusion's better. That's because they don't know how to do the surgery. I used to do fusions all the time. I've done 1,000 fusions on the neck in my career. That's more than 90% of spine surgeons. Okay? 90% of spine surgeons do less than 1,000 fusions on the neck. Very few spine surgeons do more than 1,000. I've done 1,000. I've also done 1,000 on the lower back. And I've published on fusions. So I know a lot about fusions. I did them for many years. And I can tell you they're completely unnecessary 98% of the time. Now, if you have a tumor eating into your spine, destroying your spine, then I think fusion may be necessary to stabilize the spine under those circumstances. But when it just comes to having degenerative instability, which is pain, neurological deficits, I think the best treatment is going to be the Deuk laser disc repair. That's why we do it. I wouldn't do this surgery if there was a better surgery for treating instability. This patient has instability. Part of the problem is there are so many people that are redefining instability out there into what they want it to be. The reality is instability was first defined by Doctors White and Punjabi. Doctors White and Punjabi defined instability of the spine as severe pain, basically spine pain, or neurological deficit with normal physiological loads. You can find it in their textbook that was published back in 1978. The name of the textbook is eluding me at this time. But it's a spine medical textbook, obviously, that's been used for many years. All right, this is herniation right here. You can see the gold color means it's calcified, and we're getting rid of it. Just below it is the spinal cord. So I have to be very careful. I'm going to pull back just a little bit. I want to make sure we get it all. Any questions?
We have a question from Phil Williams on Facebook.
Uh-huh.
How do you know if the annulus heals?
How do we know if the annulus heals?
Yep.
Well, that's a great question. How do you know anything heals, right? And the answer is your body heals tissues normally, naturally. We already know that. Surgeons know that. We see healing happening all the time. So, experience tells me it heals. The patient's symptoms going away tells me it heals. So there's good indirect evidence that it's healing. Now, of course, we don't want to have to cut a patient open and look and see. Even then, I don't know that you could tell if it's healed or not. This is scar tissue here, right on top of the posterior longitudinal ligament. PLL. You can see that down there. Just about done with number 5-6. Then we're going to move on to 6-7. See that? That's the top of the spinal cord right there. We took out probably around 10 pieces of herniation from this particular disc. And one of them was just so scarred down that I had to just work on it with the laser. I didn't want to come out as a big chunk. But this is the foramen on the right. It looks good to me. I don't see any more herniations here. Just a little bit of scar tissue I'm going to remove just to make sure. Yeah, it looks good. We're done here. We're going to put a little antiseptic. So that went very well. My next disc will be the C6-7. We're going to bring the X-ray back in so that I can see what I'm doing, and I'm going to move everything south one disc. Any questions?
We have a question from Charles on YouTube.
Hello, Charles on YouTube. Welcome to our live stream.
Dr. Deuk, do you use this procedure for symptomatic osteophyte removal when that's the only diagnosis?
Would I use this procedure for symptomatic osteophyte removal? The answer is no, I would not. But I've never seen that condition in 26 years of being a spine surgeon. I'm not sure who made that diagnosis, but I think that diagnosis is wrong. So I would never do surgery for symptomatic osteophyte with the laser surgery, but then again, I've never done surgery for symptomatic osteophyte. I think that's a made-up diagnosis that's not real. Okay, 2, 3, 4, 5, 6, 7. We're going to go south now, down to number 6, 7. First, I'll take this tube out. I'm going to leave the dilator. We call this the Deuk spine slide shot. I'm going to stabilize the dilator with my left hand so that it doesn't move. I don't want it accidentally moving. Hold on, shot. Shot. All right. The tube, on the other hand, I want to remove it. Shot. So you just got to be very careful. Tube is out. Okay. You got it? Let go. All right. Take that. Okay. Can you guys see? Move your hand, please. Can you see the incision here?
Yes, Dr. Deuk.
So we've completed one. We're going to go on to the next one. Shot. Now for the next one, I'm going to go south, down to 6, 7. So I'm going to come out of the disc using my fingers to feel and the X-ray to guide me. Shot. I don't need any inline traction. She's got such a long, beautiful neck.
I'm just standing here.
I know. I just wish all my patients had this kind of a neck. Shot. All right, so we're outside the disc. Now I've got to make my way south. Let's get a quick AP and make sure I'm in the middle. Quick shot right now. All right, I'm off to the side, so I got to move back to the middle.
Still very relaxed.
Huh?
Still relaxed.
Good.
Just check it.
Shot. That's pretty darn good. All right, let's go back to a lateral view. So we're going to slide down the ALL, anterior longitudinal ligament, to the next disc. We're already halfway there. Shot. Shot. All right, so that's perfect. Shot. Let's get a AP. This is the hardest part of the surgery for me as a surgeon. Just stay there. I want to move to the middle. Perfect. Lateral. I'm right between the longest coli muscles. All right, 2, 3, 4, 5, 6, 7. Everyone agrees. I'm going to anchor the tip into the ALL, and I'm going to redirect, take that, this dilator so that it lines up with the plane of the disc. Okay? Shot? All right. Give me an AP one more time just to make sure we're in the midline. It's very slippery, so you want to just double and triple check things. The price you pay for being wrong is catastrophic for the patient. So, no, Raytech. Now hammer. Shot. At this point, we're going to advance this dilator a little further into the disc. We're going to clean the center in case there's some disc material. Shot. Shot. And then I'm going to do a discogram. Shot. 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 And shot. Perfect. I like to do the discogram because I want to see the blue dye staining to the degenerated nucleus. Shot. Nice. Shot. Any more questions?
We have a question from Raul77 on YouTube.
Okay.
Good morning, Dr. Deuk.
Good morning.
What do you think of completely degenerated discs in the neck? Does laser disc repair help?
Yes, of course.
I feel like both vertebrae on my neck are rubbing against each other. Does it need a cage?
No, nobody needs a cage for any degenerative disc disease, even if there's no disc left. We have done hundreds of operations on patients with degenerative disc disease, no disc left. Okay? You don't need it done. We get rid of the pain and symptoms completely. The surgeons will try to convince you you need a fusion done in a cage, but it's not true. I used to believe the same thing. All right, this is the tube we're using. It's 4 millimeters wide. You can see that, right, Sanjay? Zoom in and show.
Yes, Dr. Deuk.
You see that?
Yes.
All right, so we're going to go and put the tube over the dilator. Shot. All right, now you can see with the x-ray, Sanjay, the tip of the tube is at the front of the disc. Thank you, Jordan. You guys see that?
Yes, Dr. Deuk.
Shot. All right, so we're going to advance the tube. Shot. Keep an eye on the dilator. You never want to advance the dilator. See, and also the dilator can come back, just like that. You don't want that. Then you're going to do a biopsy. Shot. We don't want a disc biopsy. If you don't put the dilator tip back, then you'll biopsy the back of the disc, because you don't want that. You're trying to preserve the disc as much as possible. The reason why degenerative disc disease is not needed to be fused is because, quite simply put, the cause of pain in degenerative disc disease is a tear in the back of the disc called the annular tear. The annular tear is still there, even in degenerative disc disease. Okay? The problem is other surgeons don't know how to fix the disc without fusion. So they recommend fusion. What you're doing if you accept fusion for degenerative disc disease is you're saying, I will accept the surgery my surgeon wants to do because they don't know how to do a better surgery. Now, if you're okay with that, then fine, get it done. But if you're the kind of person who wants the best surgery in the world, by far, for your problem, then you want this surgery. And your surgeon will not know how to do the surgery. They know how to do the next surgery, the next best surgery, which is fusion. And fusion is so much worse than the surgery that it's not even really in the same category. I used to be one of those surgeons before I learned endoscopic surgery with the laser. And fusion used to be the best treatment available. But then when I learned this technique with the endoscope from the Koreans, I realized there's better surgery available now. And I had to bring it back to the United States. It turns out now I'm bringing it to the world. But the South Koreans were the first to do endoscopic cervical spine surgery like this. And they did not do the laser surgery like I'm doing, the annular debridement. But they did endoscopic surgery nonetheless. So I learned that from them. I talk about it quite a bit. It turns out people know some of the surgeons I trained with. Dr. Sang-Ho Lee, the founder of Woodidal Hospital in Korea, South Korea, and Dr. Gun Choi. Many years ago, I traveled from the United States overseas to learn from them the endoscopic technique. And I've been performing it now for 17 years, with over 1,800 of these surgeries performed here at Deuk Spine by me. So we have a lot of experience with this surgery, and it's far better than any fusion. I used to do fusions, okay, all the time. If you don't believe me, go to my YouTube channel and look it up. You'll see fusions. As a matter of fact, I've been broadcasting fusion surgery for 10 years, live, just like I do laser. But just in the last couple of years, we've switched completely to the endoscopic laser surgery. Nobody wants fusions. They don't travel here for fusions. They should. If they want a fusion, we do it better than anyone else. But everyone comes because they want this laser surgery. So it's not that I don't know how to do fusions. I know very well how to do fusions. We do a really good fusion here. Any other questions? Let's flip.
We have a question from And Justice for All on YouTube.
Hello, and Justice for All. How are you?
Dr. Deuk, last week I watched one of your surgeries, bilateral L5-S1, and you didn't access the left side due to anatomical difficulties.
Yes.
Could you give us some update regarding the outcome of the surgery?
Yes. Yes, I saw the patient the next day, and his back pain was 100% gone, and his leg symptoms were 100% gone. So even though I couldn't do the left side, he didn't have the left leg symptoms. And I'll tell you why. I've seen this before, many times. If you treat one side, the right side in his case, sometimes it really helps the left side. I don't know how exactly, but I think it has to do with pressure. By reducing the pressure on the right side, by doing the laser on the right, it causes the left side to bulge out less. Therefore, the left side becomes asymptomatic or no symptoms. So I didn't expect his left leg symptoms to go away, but they did. And I told him, you know, right after the surgery, I couldn't get to that other side. So he knows, but his back pain is gone and his leg symptoms were gone when I saw him afterwards. So I'm hoping that he's continuing to do well. I haven't seen him since his post-op visit, but typically people call me when they have a problem, so maybe he'll call me if he's having a problem, but as of the day after surgery, he had zero pain. He was very happy. I mean, he wasn't happy we didn't do the other side, obviously. Nobody's happy that you can't complete the whole surgery you plan to do, but he was happy with the actual results. So I've seen that before. It's not the first time. I've seen it many times. These are all herniations, by the way. These pieces coming out. You guys are seeing them. They're all about 3 to 4 millimeters long and about 2 to 3 millimeters wide. But they're herniations nonetheless, and you can see where they're coming from, right where the spinal cord is and the nerves are. So it's going very well for this patient. I'm very happy. She traveled from Minnesota here to have this surgery done. She's been watching our Deuk laser disc repair now for a long time. I'm not going to tell you who she is, but she did her research, didn't want fusion. As a matter of fact, I don't think they even offered her fusion where she's from. I think her herniations were small and the doctors just pretty much ignored them, as they often do. Yet she couldn't ignore her symptoms, her pain and suffering. So she found us and came here, and now we're actually fixing her neck. I'm very happy for her. And now that I'm here, I'm seeing all the stuff, the herniation. I know we did the right thing. This is 6-7. I think she was debating doing one of the discs. It may have been the 5-6, if I'm not mistaken. I have to go back and look. In the end, she agreed to fix all of them, the 3, and I think that was the right choice. We don't tell patients what to do. We tell them what we recommend. In the end, the patients have to choose. Everything okay, guys? Any more questions?
We have a question from Musterman. Actually, he's seeking an advice.
Sure.
Hey
Okay.
doc, hey doc,
Hey
my,
there.
my muscle is spasming on opposite side of the turn.
Uh-huh.
I apologize for my enunciation. It's sternocleidomastoid muscle,
Yeah, sternocleidomastoid. Good job there, Sanjay. You did great.
possibly
All right, let's show the herniation that just came out. Let me interrupt. Hey, can you see this, Sanjay? I just pulled this thing out.
Yes, I do
All
that.
right, so let's take a look. Sorry, we'll get back to his comment or question. Can you see the herniation?
Yes,
We
I
just pulled it out at C6-7.
yes I
It's
do.
huge. Go ahead and get this for the video. Get a nice picture of that.
Copy that.
You got it?
Yes, I
Zoomed in?
do. Zoomed in.
All right, that's a herniation. One of several. You know when you've got a big one coming out because it makes a sucking noise on the tube, right? Was I this way? Yeah. All right, sorry. So go ahead and ask. So he's got, was it a herniation that he has?
He said sternocleidomastoid,
Sternocleidomastoid spasm. Yeah.
possibly dystonia
Yep.
or torticollis.
Uh-huh.
Do you guys treat this at Deuk Spine? And if not, any advice?
Yeah. So we do not treat primary torticollis, which is basically your muscles are just spasming. If you have an underlying cause, like a herniated disc, we treat that. So if I were you, I would do a free MRI review and let me look and see if you have something I can help you with. But if you have primary problem with the muscle or the muscles are spasming without any neck pain, then you want to see a neurologist and you want to go to what's called a movement disorder program. Movement disorder program. And the one that I know that's close by, like the University of Miami has one, and the University of Florida has one in Gainesville, Florida. There's a big herniation also right there. You guys see that thing? I need to grab it out.
Yes, we do, doctor.
So movement disorder program neurologist. And there are possibly, they need to make a diagnosis first, and then they need to treat it. And sometimes it's medication, sometimes it's surgery. There's now what's called deep brain stimulation, but also there's new studies being done on basically implanting a catheter into the brain in a certain part of your brain, which then releases neurotransmitters, which then cause those abnormal movements to get better. So it's not something I do at Deuk Spine, excuse me, but it's something that should definitely be investigated by the right type of doctor, and that's a movement disorder center. Okay. A lot of scar tissue here at 6-7, but looking good nonetheless. Gotten rid of the herniations. And we'll look the other way and then we'll be done. I don't see anything on this side, but let's pull back a little and Maybe one right there. Great questions, by the way, from our audience. Thanks for asking. It's funny because she told me, my patient told me, don't answer too many questions. Stay focused on my surgery. I said, don't worry. If I need to focus, I'll focus. You know? I always found in life that I do best when I'm teaching others. All right, any more questions, Sanjay?
No questions.
All right, good. So we're just about done here. And I don't see anything more in that foramen. There's a little bit of scar tissue, but I don't see any herniation. All right. That's 2 down, 1 more to go. We're going to next move up to the C4-5 disc. It's quite a ways away, but I think we can do this. Well, let me try, and I'll tell you.
Give her a dose. I'm ready to go if you need it.
All right. I wouldn't do it just yet. Let me see if I can get up there easily.
Twitch.
Yeah, I think we're okay.
All right. Then I want a hard time making it.
I think we'll be all right without anything. She's got a thin neck.
I have it ready.
Appreciate that. Perfect. Show us north a little bit, just north a little. All right, I'm going to take this tube out. So far, we've lost 1 drop of blood. If you've been counting, like me, you noticed we lost 1 drop of blood. Shot? All right, so I'm pulling back the tube. We're out of the disc. Shot? You guys see that? Oops.
Yes, we
Every
do.
time I do that, it literally lifts it off. Shot? There we go. Beautiful. Take yours. All right. So 1 drop of blood, the whole surgery. 3 levels of discs repaired. We're almost done. Okay, 1 more to go. And shot. I'm going to bring this dilator out. Shot. We're going to do the Deuk spine shuffle. Right up the spine. Shot. Almost there. I could feel just the edge. And we're out. All right. Shot. AP, I want to make sure I'm in the middle of the spine. It's very important. Stay in the middle. Come on, Jordan, quick shot. All right, perfect. Now I'm going to bring it north. By the way, it wants to go north because, well, that's where we started, right? Shot. Huh. Perfect. 2, 3, 4, 5. So we got to go up 1 more. Let's get a picture where we are here. I feel like I popped back in the disc. Quick shot, Jordan. Quick shot. Now, shot. Off to the right. Stay there. Huh. Any questions?
We have a question from Premier Media Group on YouTube.
Oh yeah, of course.
Good morning, team.
Good morning.
Any idea when you'll be scheduling the thoracic surgery from San Diego?
Hold on a second. Shot. All right, lateral. When we'll be scheduling the thoracic? I don't know the answer to that. I have to talk to my team. Great question. I don't have an answer. Anybody know when the thoracic is being done? Is it on the schedule there, Sanjay? On the calendar?
No.
All right. Maybe you can ask Richard and find out.
Yes, copy that.
Shot? Yeah, I'm sorry I don't know the answer. Shot? I'm not sure. I know we've got a thoracic coming up. I know we had a guy from San Diego. He flew out. Shot? Quick AP? He flew out with thoracic pain. He's got, I want to say 2 discs we're going to fix. Shot? Lateral? Shot? All right. Shot? Shot? We're anchoring and we're passing through the anterior fiber. Shot? Now I want to get a quick AP just to make sure nothing's moved to the left or right. Remember, you want to be as center as possible on the AP view, front back view. That's perfect. Lateral. Yeah, so as far as the thoracic goes, I just don't know when it's going to happen. I know that the patient flew out here just to get the diagnosis made, and we saw another thoracic, I think it was yesterday in clinic, from, I want to say Fort Lauderdale or from Fort Myers. And then we had another thoracic who flew out here a few weeks ago, and he ended up not being able to show us where his pain's coming from, so we canceled him. Shot? I can't fix pain where the patient doesn't have it. Right? I'm sure he'll be back. I think he had an epidural or something, so he was feeling pretty darn good. You can start to see the tear there. Shot? You guys see the tear? Shot? Just a little bit in the back of the disc. Yeah, right there. Just barely made it out. Shot? So I'm going to advance this dilator. Stay there. Shot? And let's see. You can kind of see the tear in the back of the disc now. Shot? Oh, yeah. Now you can really see it. Right there. Perfect. Stay in the lateral view. 2, 3, 4, 5. Everybody agree? I'm planting the dilator within the tear. You can actually see the herniation's pretty big. Show us the herniation there, Jordan. We're now at the back of the disc. I'm going to bring my tube down. And the good news is we got everything done with one cut, with 1 drop of blood. This is our new record. Dr. Berndash? I know I've had some bloodless surgeries, but 1 drop of blood, literally 1. That's incredible, folks.
Less than getting a cavity drilled.
Or a root canal.
You had to say that.
Bad memories. Folks, literally 1 drop of blood surgery, spine surgery, with 3 discs. If this had gone for an ACDF, it would have been, if I did it, it would have been 50 cc's of blood, but the average, maybe 25, but the average spine surgeon, it would be a couple of hundred. So, alrighty, we're sliding along. I need to get to the back of this disc where the tear is. That's after all what we're here to fix, the tear. I need to advance the dilator. Almost done. I've got 10 minutes probably, Dr. Berndash. Maybe 15 max.
It's a good idea to give that extra dose.
No, I'm glad you asked. It's just her neck is pretty thin. I can feel I'm fighting the muscles a little bit, but not bad. Not enough to warrant giving more muscle relaxer. All right, any questions from our audience?
We have a question from Loretta
When you see
On-
water here, you should grab a towel. Yes, Loretta.
on Facebook. Is there a maximum number of discs you will repair in one surgery?
Loretta, great question. The answer is it depends on where the discs are, thoracic, lumbar, cervical. We could do 4 discs in the cervical. I don't know anybody that needs more than that. And we can do six areas in the lumbar, and we could probably do 4 in the thoracic. So I would say 4 cervical, 4 thoracic, and 6 lumbar at one time. That's my best guess. Once again, you can see lots of herniation in this C4-5 disc. Scar tissue, calcification. Scar tissue is the white stuff right here. The blue stuff is the herniation. Lots of it. Actually blue and white. Some of it's white because it's scarred up. We're almost done. That's a scarred herniation right there. You guys see it? Impressive. Like right here. Sitting right on top of her spinal cord. She's going to feel so much better after this. So happy for her. Yeah, big piece of herniation just shot out. There's another piece of herniation. Look at all this herniation. We float them out of the tube. That's the beauty of the surgery. The tube is a conduit. There's more. Okay? Those really nice blue ones are younger herniations. The white, thick, hard ones are older herniations. That dye that you're seeing is coming from the epidural space that we injected earlier. That's a tear in the back of the disc. That's where now the dye is coming back towards us. We injected it earlier, went out the tear around the spinal cord, and now it's making its way back. Because the tube is a conduit. Remember, it's a conduit. It's a channel. It's a way for us to not just put things in, but take out. 5 minutes. Lots of pieces of herniation on this one. I've counted at least 10 so far. Any questions from our audience?
We have a question from Beth on YouTube.
Sure, Sure, I'll take it.
Good morning, Dr. Deuk.
Good morning, Beth.
I was curious as to when you first learned about this procedure.
Yeah.
Why did you want to? And how long did it take you to learn in order to go on your own?
Great question. So I first learned about this endoscopic surgery 17 years ago. And at the time, spine surgery was undergoing a lot of change. And it still is. At the time, surgeons were trying to do the thing about spine surgery is it can be very helpful, but the problem is getting to the spine can be very, very invasive, very damaging to the patient. So once you get to the spine, you could fix it, but getting there is always traumatic, very traumatic for the patient. And we call that the exposure. And at the time when I was training, we were working on a less invasive exposures. That was sort of the thing to do. Yeah, we knew spine surgery was good, it was helpful, but doing with less exposure, less bleeding, less trauma to the body of the patient, that was the goal. And so there was a movement of smaller and smaller and less invasive approaches. We call it the approach or the exposure. And of course, you know, where I trained at the University of Florida Department of Neurosurgery, we were the very best in the country. And that's the problem. We were the best in the country, United States. But it wasn't the least invasive in the world. I didn't know about this technology because it wasn't available in America at the time. And when I first heard about it, I thought, you know, it's nonsense. I don't believe it, right? Like everybody else. I'm no different. I doubted that it was beneficial because I knew there were all these doctors trying to make a name for themselves and trying to make money off of new ideas that didn't work. So I was extremely skeptical, like other people should be and are. And I went to watch it like I had watched other things. And when I watched it, I thought, this is crazy. Like, I would never do something so risky, so dangerous for the patient. And then, lo and behold, the patients did well, the ones I watched, and I realized that I was watching something new, something advanced, something better, something that could possibly open doors in terms of treatment for patients to have less invasive surgery with better results. So over the years, I started to perform these surgeries myself, and I would perform them on my patients who wanted them. And I had a lot of patients who wanted them, it turns out. It was the same time I was working with a large group of patients that were injured, and they had nowhere else to go for surgery. So they came to me, and they wanted this endoscopic procedure, so I did it. And I got really good at it, doing it. I realized after doing hundreds of them that it was safe. And then I started looking at my results more carefully and did a data analysis of the chart review and looked at outcomes, and we published our first paper in 2011 was the first paper we published at a national meeting on the Deuk laser disc repair. 2 minutes. And then I published our first peer-reviewed publication in Surgical Neurology International, which is, of course, open source and available. Anybody that wants to go read it, you can. So I started doing these 17 years ago. And of course, I was scared to death at the time, to be honest. I may not seem like the kind who gets scared, but you're dealing with a person's life. And I wanted to make sure, you know, it's one thing if the surgery doesn't work, it's another thing if you hurt the patient, right? So there's two things you got to worry about. You know, you want to do surgery that helps people, but you also don't want to hurt them in the process. So there was a lot of unknown at the time. Is it going to help, and is it going to hurt? That's really the two big questions that every surgeon or doctor should ask. Is it going to help, and how much, and is it going to hurt? And it turns out that it didn't hurt. There were basically no complications at all. And the amount of pain relief was 100%, which is the symptom I was targeting. Pain relief in the neck, the back, down the arm, down the leg. And it was consistent every single time. And that's when I started to realize that what we were doing was targeting the actual source of pain, which nobody else in the world had ever done. The actual source of back pain and neck pain. And that's when I realized it was the tear that I was targeting with the laser and repairing at the back of the disc. That was the actual source of pain. And of course, here we are 17 years later doing thousands of these surgeries. By the way, here's the incision. You guys see this? Let me have that tape measure. So let's get a nice final picture here. No bleeding. We had 1 drop of blood the whole surgery. Okay, can you guys see this?
Yes, we do, doctor.
That's the Deuk laser disc repair right there. No need for fusions, no need for metal cages, fusion, loss of movement, hospitalization. This patient's going home in an hour. 1 hour. And she's from Minnesota. So she'll stay in the hotel. She'll come in and see me tomorrow. And then she's going to head home, I think, tomorrow afternoon by flying home. Back to normal activities within a day. The only therapy these patients need is walking and some stretching, where they take their collar off and they just kind of, I got it, where they kind of stretch side to side. We call it the yes and no exercises. They do that for a couple of weeks, just because the collar will make their neck stiff. You know, the collar will make, so 1 drop of blood, 4 millimeters, the most perfect spine surgery in the world, right there. You just watched it. All right, thanks for joining us. Write your questions up. I'll come answer them for you. I'll be there in just a few minutes. Let's go ahead and show our audience a nice testimonial of one of our patients that had this done. I'm Dr. Ari Deuk with the Deuk Spine Institute. We have a patient who just had surgery yesterday. And if you were tuned in online watching our live surgery broadcast, you saw her get 2 discs fixed in her neck. She's had a prior fusion done with an ACDF and a metal plate, so we fixed the disc above the fusion and below the fusion. She had adjacent segment disease. And how long were you suffering with neck pain and right arm symptoms before you came to Deuk Spine to get it fixed yesterday?
Over 20 years.
Over 20 years.
Over 20 years.
And you had the Deuk laser disc repair done. You can see we had to make 2 incisions on the front of your neck. How do you feel after the surgery you had yesterday?
Awesome. Never felt like I've not felt like this, and I couldn't tell you how many years. I've not been able to actually have a normal life due to the pain. Hurting so bad, having to lie down during pretty much after lunchtime.
Do you still have that pain right now?
No, sir.
It's gone.
Gone, yes.
Yeah, your neck is still a little stiff, and you
Yes.
got to get used to that. But you did have the fusion, fusions always cause neck stiffness, and we can't fix that. But the pain we can fix. So the pain you had before is gone.
Yes, sir.
You happy?
Very, very happy. That's an understatement.
Now you have a funny accent because you come from Bluff City, Tennessee. Isn't that right?
Yes.
All right. And why did you travel to Florida for your surgery?
Done a lot of research, and then I found you. Thank God. Greatest blessing that I've ever had. Best doctor I've ever been to in my life.
Thank you.
I can't really put into words how I feel. It's beyond. It's the greatest blessing ever. It truly is.
Well, I'm glad you're doing well. I know your husband is here. He's been very supportive. He was here throughout the surgery yesterday, and you can actually see in the video footage that we made 2 tiny little 4mm cuts in the front of your neck, went down through the neck, not damaging anything inside, and getting to the herniations where the tears were. And actually, you could see the tears on the discogram that I did. And they were big, and we were able to get in there and clean out all the herniations with the laser, and we didn't have to do fusion anymore. We didn't make your neck any worse than it came here with. And the nice thing about the Deuk laser disc repair is it's a stabilizing procedure, getting rid of pain and neurological compromise. I checked you today. You came to us with weak arms, and now you have normal strength in your arms just 12 hours, 24 hours after your surgery.
Yes. Not had that in so many years. So many years.
All right, well, is there anything else you want to say to your fans out there?
Anybody suffering with chronic pain, you have no idea. It is well worth coming to see. Like I said, he's the best doctor I've ever been to in my life. He actually cares. First doctor I've ever had in my life to hug me and ask me how I'm doing.
And compliment you on your nails.
Exactly. He loves my nails.
I
He
do
loves
love
my
your
nails. Highly recommend him, like I said. Very well worth everything. He truly does care. And the team here is awesome. The nursing staff, everybody was tremendously, I can't express enough how everybody was so good to me and just went out of their way to make sure that I had everything I need. I was comfortable. You know, it was just a very wonderful experience. It truly was.
And I appreciate you sharing. You also had the Deuk plasma rhizotomy, I just remembered, because she had facet joint pain as well as the disc problem. And she was having pain turning her head to the right, weren't you?
Oh yeah, I couldn't. I was having extreme pain. I was turned into when I couldn't hardly turn to my right. It was going down into my right arm extremely bad.
And that's gone.
Yes.
Amen. And it's gone permanently. So I'm very happy for you. When are you heading back home?
Saturday morning.
All right. Well, enjoy Florida for a few more days. You take care of yourself. You've got my phone number if you need anything.
Yes.
All right.
I thank
take
you
care.
so very much.
You are more than welcome. It's my pleasure to take care of you.
Even with my funny accent.
All right, let's get you out of here, okay? Go enjoy the beach or something. I'm I'm Dr. R. Deuk. I'm here with one of my patients on February 1st, 2023. And you just had surgery on your neck, the Deuk laser disc repair done with a 4mm incision to fix 2 herniated discs, her C6-7 and her C7-T1. And you had a long neck. We were able to get down to the C7-T1, and she had a very large herniation there. So your surgery was about 24 hours ago. How do you feel today?
I feel like a different person. I feel I was able to do many things this morning that I haven't been able to do for 4 months, and that is just get out of bed and just take my first steps and have 0 pain. And I haven't had that in 4 months. First step out of my bed was always the beginning of my day, and it was awful. And today I took my first step out of the bed and it was glorious. Good
for you. And before surgery yesterday, you had been suffering for about 6 months with neck pain going into your right arm, correct?
About 4 or 5 months.
How did that affect your quality of life?
Every day is difficult. I mean, I have a 10-year-old and a 5-year-old boy, and just the basic duties of a mother every single day was just unbearable and difficult. So quality of life was not very good. And so it is now.
And so the pain, obviously, because of the pain, activities would set it off, so you were limiting what you were doing. You were limiting what you were able to do as a mother.
Yes, there was things I were not able to do, and be the best mum that I can be was not one of them.
Well, you look very happy right now.
I am.
Why are you so happy?
Because I'm pain-free.
Yeah, and you didn't have to have a fusion or an artificial disc put in your neck, did you?
I did not.
Did anyone offer those surgeries to you?
I did. I was offered those surgeries. I was told that I needed a fusion, the possibility of disc replacement in 1 or 2 years down the road, but it was my decision to go in and have those taken care of if I wanted to. But there was also a possibility that once the doctor got in, that he could not replace those 2 discs, so he'd have to fuse those 2. So that to me was a possible 3 fusion, 3 discs being fused. Mm-hmm. And I know the consequences of that, so that's why I came for your opinion, in your professional opinion, what can be done in a less evasive way. Or that was an option for me, and here I am.
And I'm really happy it worked out for you. You can see in the video, we were able to get down to C7 T1, which is really a first endoscopically. And because you had that nice long neck, we were able to do it. And there was huge pieces of herniation down there. Your other disc was more degenerated, and we were still able to get that fixed as well. So I'm very happy you're doing well. What's life going to be like now that your neck is fixed?
My quality of life is just going to be a lot better than what it was. I'm going to take it easy, and I know that I need to take it easy, and I'm going to be careful, but I'm going to wake up with a smile on my face now instead of tears.
Well, congratulations.
Thank you so much.
Is there anything else you want to tell your fans out there?
Come see Dr. Deuk. He'll fix your pain and make you walk out with a smile on your face.
Excellent. All right. Good to see you.
Thank you. Thank you so much.
Wow, what a great surgery, and what some great testimonials from past patients. Our patient here is from Minnesota, and she's been a long-time fan of the Deuk Spine Institute and our channel. And she finally pulled the trigger, and came down to Florida for her cervical Deuk laser disc repair. And I just want to tell her thank you. Thank you for having a great neck and being such a great patient during the surgery. She was asleep the whole time, and she had like I said, I wish everybody's neck was as perfect as hers. That said, she had injured her neck in the past, and during the surgery you could see as we went from disc to disc to disc that there were herniations in all 3 discs. Some of those disc herniations looked older, some of them looked more recent. The last one we just did, the C4-5, appeared to be more recent, and I can't remember, one of them was older, more degenerated. There wasn't much in the way of bone spurs that I saw. I certainly didn't see any bone spurs that I felt needed to be removed. Removed some small stuff that was calcified, but overall the surgeries went perfect. I expect her to do great. My expectation for her is to get rid of her headache, her neck pain, her pain going into her shoulders, and the symptoms in her arms. It turns out most of these symptoms are due to what's called inflammation. Inflammation is a process where your body has a system called the inflammatory system made up of cells and chemicals, and these cells and chemicals can do a lot of damage. Their purpose is to attack foreigners, foreign invaders, things that are a threat to your body and your health. The problem is sometimes when they attack, they're attacking your own body because they don't realize what they're attacking is part of your body. And the disc herniation is one of those cases. And I've been trying to teach my colleagues about this for years. They just don't listen. But patients need to listen because after all, you're the one suffering. So we can fix your pain by going in and getting rid of the source of inflammation along with the inflammation itself. Now, as I was coming in here from the surgery, I had some aches and pains of my own. As I'm getting older, I'm starting to feel them. And that reminded me to put on this hat today. This is the Deuk Joint Institute hat. The Deuk Joint Institute, after 20 years of the Deuk Spine Institute being in business, we've created the Deuk Joint Institute. And the reason we're doing that is because we have now discovered a way to get rid of pain in the knees, the shoulder, the hip, as well as the tailbone or SI joint, all without doing any open surgery, minimally invasive, and the relief is permanent. It's a process called rhizotomy, and it's a technique that I'm patenting. It's patent pending, and it's called the Deuk plasma rhizotomy. And what happens here is we'll take a joint, for example, the shoulder joint. We know the shoulder joint has nerves, sensory nerves that go to it. And if you actually attack these nerves and cut them, these sensory nerves right at the joint, okay, suprascapular nerve, the articular branches of the axillary nerve, and the lateral pectoral nerve as it courses over the coracoid process, as well as above or below the coracoid process base. If you attack these nerves and you do the Deuk plasma rhizotomy, it's an outpatient procedure. It takes 20 minutes to do. We can get rid of shoulder pain completely, especially shoulder arthritis pain. Now, of course, there's other things around the shoulder that cause pain. For example, the rotator cuff, the impingement from the acromioclavicular joint, as well as bicipital tendonitis, and a few others. But arthritis of the shoulder joint, which is what's the main driver of shoulder replacement, can be completely treated with the Deuk plasma rhizotomy for the shoulder. We're also doing this for the knee. If you have arthritis in the knee and it hurts, you don't need to have a joint replacement done anymore. We literally go in and destroy 3 nerves. 1, 2, these supragenicular nerves, medial and lateral, and then this inferior medial genicular nerve. And we do this percutaneously. It takes 15 minutes to do. We're doing them at the Deuk Spine. We pioneered this technology. I pioneered this technology. I discovered it, and it is being patented. But we're able to eliminate knee pain, hip pain, shoulder pain, and we're going to be working on other body parts too. So that's exciting. It's exciting enough that we created the Deuk Joint Institute. And we're going to give all these other big orthopedic companies a run for their money. Okay? But if you want less invasive, non-implant based surgery to get rid of your symptoms, this is the way to go. All right, Sanjay, do we have some questions?
We have a comment from And Justice for All. Good morning, Dr. Deuk. Thank you for using the metric system like the rest of the world, so all foreign visitors like me could understand.
Well, thank you, And Justice for All. It's my pleasure to use the metric system. So, thank you.
Next question's from Justin K on YouTube. Hello, Dr. Deuk.
Hello, Justin.
Would love to get my conditions evaluated by you.
Be happy to evaluate anybody's back pain, neck pain, thoracic pain, or even their hip, knee, or shoulder pain. All you need to do is use our form on our website at mri.deukspine.com. It's a free evaluation. We'll spend 10 minutes with you on Zoom, and we'll assess your situation, figure out what's the best treatment for you, and give you that recommendation right then and there. And then my team will follow up. They're schedulers. They're going to look at the insurance. They're going to look at the procedures we're recommending, the cost, and they'll get back to you with how to schedule, basically.
And that's all for this session.
All right, well, I hope you enjoyed it. We'll be back with a gentleman who has two herniated discs in his lower back, among other things that are going on. He's also got scoliosis, he's got stenosis, listhesis, he's got it all. All the things that you typically find on an old degenerative spine. But we believe that the majority of his pain is coming from two discs, L4-5, L5-S1, and that's what we're going to fix. So join us in about 30 minutes for another Deuk laser disc repair on a very degenerated disc patient. You'll see we can still do the surgery as long as I can get into the discs to fix them.